Today, I want to talk with you about something that may seem small, but it makes a huge difference in patient care. Choosing the right vein for a peripheral IV. When we pick the wrong vein, patients suffer more pain, we make more attempts, and complications go up. But when we choose well, everything gets better. Let me start with why this matters so much. Every time we miss a vein, the patient feels more discomfort. Multiple needle sticks cause bruising, swelling, and anxiety. Poor choices also damage veins over time, making future access harder. Studies show that failed first attempts increase the risk of vein inflammation, fluid leaking into surrounding tissue, and blood clots in the vein. These problems lead to longer hospital stays, higher costs, and unhappy patients. For many years, we relied on feeling the vein with our fingers, the old blind technique. We looked for a vein that felt bouncy, straight, and close to the surface. But in patients who are older, overweight, dehydrated, or have had many IVs, those veins can be hard to feel or even collapsed. In those cases, we often ended up sticking the hand or wrist, areas that bend a lot, move constantly, and have smaller veins. That leads to more failures and shorter catheter life. Now here is where ultrasound has completely changed the game. Ultrasound lets us see the vein in real time. We can measure its exact size, depth, and direction. We can spot valves, branches, or nearby arteries and nerves that we cannot feel with our fingers. This means we can safely choose better veins, especially deeper ones in the upper arm such as the basilic, brachial, or cephalic veins. These upper arm veins are usually larger, straighter, and more stable than hand or lower forearm veins. Because they do not cross joints as much, the IV lasts longer and the patient can move more freely. Ultrasound also helps us avoid areas that flex too much or have lots of valves, which reduces irritation and blockage. The most current guidelines from the Infusion Nurses Society, the 2024 Infusion Therapy Standards of Practice 9th edition, strongly support this approach. In Standard 25, Vascular Access Device Planning and Site Selection, the INS recommends assessing vein diameter, depth, and length before insertion. They advise using ultrasound when the patient has difficult access, that is, when veins are not easily seen or felt. The guidelines state that a suitable peripheral vein should have a diameter of at least 3 millimeters and a straight segment of at least 2 to 3 centimeters. Depth should ideally be no more than 15 millimeters for best results. In Standard 21 Vascular Visualization, the INS gives Level 1 evidence, the highest level, for using ultrasound in patients with difficult access. They note that ultrasound increases first stick success, reduces the number of attempts, and lowers the need to place more invasive central lines. The standards also stress training and competency. Anyone using ultrasound must be properly educated and skilled. Let me share what the research shows. With ultrasound, first attempt success rates often jump from around 50 to 60%, with blind sticks to 85 to 95%. Fewer attempts mean less pain and less vessel damage. Catheters placed with ultrasound tend to last longer because we pick better locations. Patients report higher satisfaction, and nurses spend less time on repeated sticks. Ultrasound also helps preserve veins for the future. By using deeper, more appropriate veins early, we save the smaller surface veins for later needs. This is especially important for patients who need long-term treatment, dialysis, or repeated hospital visits. In low-light or emergency situations, ultrasound is even more valuable. It cuts through the guesswork. We see the vein clearly even when the patient is cold, dehydrated, or has dark skin that makes veins hard to see. To sum it up, proper vein selection is one of the most important skills we have. Choosing the right vein reduces pain, lowers complications, saves time, and improves outcomes. Ultrasound has transformed how we do this by letting us see what we could only imagine before. The 2024 INS standards make it clear. Use ultrasound for difficult access, assess vessel size and depth carefully, and always prioritize the least invasive option that meets the patient's needs. When we follow these practices, we give our patients safer, more comfortable care. And that is what infusion therapy is all about. Doing what is best for the person in front of us. Thank you for listening. Let us commit to choosing wisely and using every tool we have to get it right the first time.